I've had the privilege of always being out as a queer provider. And, I know that that is a huge privilege that many people historically haven't had and still don't have. But I think it has allowed me to connect on a more personal level with my queer patients.
That was Marea Goodman. Marea is a midwife, and as a member of the queer community, Marea has a special focus on LGBTQIA+ midwifery. She's also co-written a book called Baby Making for Everybody, and she's founded an online community called PregnantTogether. Today, we're going to get to know Marea, and we're going to learn about the role of the midwife. I'm Dan Bulger with Progyny, and this is Infertility. Hello and welcome. As I mentioned at the top, today we're going to get to know Marea Goodman.
My name is Marea Goodman. I use they, them pronouns. I'm an out-of-hospital midwife in Santa Cruz, California. The co-author of the book Baby Making for Everybody and the founder of PregnantTogether, which is a virtual community for queer folks and solo parents from preconception through parenting. And probably most importantly, a parent to 3 kids who are currently 3, 6, and 14.
We're going to learn more about the community PregnantTogether, which Marea founded, in a bit, but we wanted to dive into midwifery. So let's go.
So in the United States, there are 2 different paths to becoming a midwife. One is out-of-hospital midwifery. Some people call it direct entry midwifery. We are licensed by the specific state that we live in, and not all states have midwifery licensure. So in California, we have licensure. I'm licensed by the California Medical Board and have been licensed since 2015. The other path towards becoming a midwife in the United States is to be a certified nurse midwife. So to go to nursing school first and then become a midwife, and you are then licensed by the Board of Registered Nurses. Primarily, certified nurse midwives work inside the hospital system. They also work at fertility clinics. Primarily out-of-hospital midwives, licensed midwives like myself, either run our own out-of-hospital birth practices, work at birth centers, or do a bunch of other entrepreneurial things like I'm doing and running PregnantTogether. What I love about the model of midwifery that I practice is so much of it, it's community oriented healthcare. So I'm licensed by the medical board. I renew my various certifications every couple of years and do continuing education and have a lab account and all of these different things. But I also get to practice outside of the mainstream medical world, which I think allows me to just be a little bit more connected to the pulse of community. I get to do a lot of one-on-one care. I have a bunch of friends who are nurse midwives who work in clinic settings, and, they have 10 to 15 minutes with their patients. And, there's just the demands of the healthcare system are different. And I think especially when we're talking about fertility and family building for queer folks and solo parents who may or may not have fertility issues and be best served in a fertility clinic. There are people that would be best served in a fertility clinic. And there are a lot of people that are like, we wish that we could just make a baby at home alone or with our partner and not have to involve doctors. And having midwives help with that process can be a great intermediary. A lot of people don't know that midwives can do at-home inseminations. So that's another thing I do is I teach midwives how to do IUIs, intrauterine inseminations. So I have a lot of clients that, I help them with their fertility tracking process and then go over to their home to do their inseminations. And it's a great option, especially for, queer couples that want a more intimate experience. They don't have to leave, and also deal with clinic hours and all of that stuff. So I think, the model is really special. And I do now, my practice is small for home birth. But I have since 2012 been attending births at home and helping people have their clients out, helping people have their babies outside of the hospital system as long as they're low risk and remain low risk. So there's a very very specific screening process that we do to make sure that out-of-hospital birth is safe. But as long as people remain low risk, it's a great option for giving birth and growing your family.
Okay, so that's a midwife. And now I know a lot of people confuse midwives and doulas, but it's important to know that they don't serve the same purpose.
Doulas are support people. So they do informational, physical, and physical support and advocacy. They don't do any medical training. So midwives, it's a 3-year program. We get trained to provide prenatal care, support through birth, handle various emergencies that could come up, very specifically understand, when to transfer care and when to consult out. So we do the medical stuff, we suture, we provide medications, handle any complications that come up, and doulas do the emotional and physical support during that process.
Midwife specialty is low-risk pregnancies where a surgery isn't likely.
In the UK system, midwives attend 90% of the births because 90% of the births are low risk, and then 10% are managed by OBs who are trained in higher risk complications. And so that's very appropriate, and midwives, our specialty is low risk. And then, so yes, midwives have been attending births forever and ever. And in the scheme of history, doctors are very new to the birth process. And I think, in the United States, where we don't have universal health care, malpractice insurance costs are so high. There's a lot that we could get into about what I think is wrong about how we approach the birth system. And, as a midwife, I love OBs, and they have a very important role in high risk deliveries. But when you look at the statistics of patient satisfaction and safety and lower risk of intervention, all of those sorts of things, it's midwife birth, that midwife led care that is more appropriate for people that don't have high risk conditions.
As a member and a leader in the LGBTQIA+ community, Marea is very in tune with the needs of her clients.
The midwifery model of care encourages patient autonomy in a different way, especially when we're doing this community-based care and out-of-hospital midwifery. And so I always tell my clients, this is a non-hierarchical relationship. My job is to provide you with information that you need to make the best decision for you and your family. And I have the training to help make sure that it remains safe.
As I mentioned earlier, Marea is also the founder of a virtual community called PregnantTogether. So I asked how they came to create that group.
I've had the privilege of always being out as a queer provider. And, I know that is a huge privilege that many people historically haven't had and still don't have. But I think it has allowed me to connect on a more personal level with my queer patients. And there's an understanding that a lot of people just don't have about the nuances of needing to choose a donor to grow your family, of what that insemination process feels like and looks like, and co-parenting in a queer relationship. There are personal experiences that I bring as a fertility provider and as, the founder of this community that I think make a difference in helping people feel seen and understood. And not to say that someone who hasn't had those experiences themselves couldn't provide excellent care. I think it's just a different relationship. And I think for the queer community in particular, when we're so used to feeling kind of on the outskirts of society in certain ways, having that resonance and understanding can really improve your experience of going through this process.
Yes, OBGYNs are incredible at what they do, and they serve a tremendously important role in our society. And that's also true of midwives. For many, a midwife might make all the difference.
It was during the pandemic while I was pregnant. I co-wrote the book Baby Making for Everybody with Ray Rocklin, who's a midwife based in Philadelphia. And through the process of including so much of our midwifery knowledge that we had gained through working with people over many years, we also really wanted to include community stories. And so we got hundreds of submissions of people just like sharing different aspects of trying to get pregnant or being pregnant or parenting or trans pregnancy, all of these different things. And it just became very clear how alone so many people feel during this process. And so the book was published in April 2023. And about that same time, I launched PregnantTogether, which is, it's so exciting because we can bring people together from all over the world. We have folks from Belgium and Slovakia and Canada. Most folks are based in the US because that's where I'm based. But it's just beautiful to bring all these people together who are going through so many similar things. So folks will post like, hey, does anyone else have a known donor with below optimal sperm count? And what did you do? And, what do you think about letrozole and the trigger shot? All of these different aspects that they can connect around. We share known donor contracts and recommendations for different providers, and just really create community around this experience that I think has historically been really fragmented. And I think what COVID-19 did, at least for me, I mean, it did so many things. But one of the things was like, I became familiar with online community and Zoom. Like that wasn't really my forte before. So I do feel like we are more able to connect with people from all over the world. And there's this, because we are a niche group, the queer folks and solo parents growing our families, there are so many more people that we can connect with when we're not just focused on our like one local area.
PregnantTogether is a resource for anyone in the LGBTQIA+ community who might feel isolated in their journey.
Yeah, I mean, the whole reason that I created PregnantTogether was for those people that I think are most of us that feel isolated in our family building journeys. I think as queer folks and solo parents, there's so many different steps, logistical steps that we need to go through, but then also the social emotional piece of like maybe our family or community not understanding or not knowing a lot of other queer couples or queer folks growing their families in your area. So I would say come join PregnantTogether. It's very accessible. It's $20 a month. You can pay with an HSA or FSA account. And we have Zoom support groups where people can chat live. We also have chat rooms for all these different experiences and different stages. So there's different sections of the community for trying to conceive, pregnancy, postpartum, and parenting. And then we have different affinity groups. We have a space specifically for solo parents. We have a space for the non-gestational parents because I understand, and a lot of people, in a queer couple, the non-gestational parent who often, but not always, is not biologically related to the child. And there's just different experiences that come up around the non-gestational parents' experience. And I see that in my clients who are heterosexual dads too. There's you just have a different relationship with the child during the gestational period. So I like to work a lot with the non-gestational parents and offer that support. And then we have a group for people of the global majority. So people who are also dealing with the issue of racism or complex ethnicity questions in this growing their family process, and really trying to make a safe space for everybody to bring all of the complex experiences of their identity that don't usually have a home in mainstream society.
I want to give a big thank you to Marea Goodman for all the work they're doing and for joining us today. And I want to thank you for listening. If you want to connect with us, you can do so on Instagram at This Is Infertility Podcast. If you want to follow Progyny, you can do that at Progyny Inc. Of course, if you're listening on a podcast app, please leave a rating and review. This Is Infertility is brought to you by Progyny. Please remember this podcast is not intended to substitute for the personalized expert advice of your physician. I'm Dan Bulger, and this is Infertility.